Good day. I'm Dr. Dale Dangleben, and on behalf of Patient Choice, this is the medical tidbit of the day. I've been talking about alcohol and different diseases, and this is the last one on that topic, and I really want to drive this one home because I think it's something that's not even discussed. It's been overlooked. I want to talk about alcohol and the breast cancer risk in black women, okay? Because, breast cancer remains one of the leading health concerns for women worldwide, right? And alcohol consumption is a well-established risk factor that we don't even talk about. Even moderate drinking can increase your breast cancer risk. And how does it do that? Alcohol increases estrogen levels, right? One, it can destroy DNA, and it actually promotes tumor growth, right? And you could say, well, it affects all women, but breast cancer affects black women in a different way because of the disparities in awareness, screening, and access to care. So this is a critical issue that we need to highlight, okay? Alcohol increases breast cancer by hormonal influence. And how does it do that? Like I said, it increases circulating estrogen levels. And what does estrogen do? We know that it stimulates breast cell growth, which then increases the chances of cancer. Prolonged exposure to high estrogen increases the likelihood of cancer development. That's a fundamental fact. And I stated before, it can damage your DNA because alcohol is metabolized into acetaldehyde, right? And that's a substance that can directly damage the DNA in your breast cells, okay? And if you have damaged DNA, which is unrepaired, that increases your chances of cancerous growth. Always lifestyle and metabolic effects has to be thrown in there, right? Alcohol adds empty calories. It contributes significant to obesity, which is a topic in of itself that we can talk about, right? And obesity is a direct risk factor for breast cancer. So we have to be aware of these things. Black women are more likely to be diagnosed with aggressive breast cancer, right, compared to white women. Black women are more likely to be diagnosed at a later stage. And the later you're diagnosed, the poorer the outcome. Mortality rates from breast cancer are 40% higher in black women. Even when diagnosed at the same stage, you have to let that sink in. There's disparity in screening, awareness, and access to care. Black women are less likely to receive early and regular mammograms. And with that said, I hope the 2 mammograms that I sent to Dominica are being put to use, even if I did not get a correspondence on whether or not it was received or not. Black women are less likely to receive early and regular mammograms, despite the recommendations that are out there. There's a lot of barriers. Cost, lack of insurance, medical mistrust, right? We need to focus on awareness and education. Where is the public health messages about alcohol and breast cancer in our community? We cannot say this is our culture and these are social norms. Even moderate drinking, right? We cannot downplay these things. And again, access to care. Wearing a pink shirt and going for a walk does not increase your access to care if you don't use the funds to buy things, to hire oncologists, right? To have regular follow-ups, to have affordable treatments. If you don't have these things, that's worsening outcomes. Healthcare bias is a real thing, okay? And we have to be aware of it. As we move forward, we need culturally relevant education on this topic in Dominica. We must talk about the link between alcohol and breast cancer in black women, right? The community centers, the churches, the social media platforms. Where is the where is the awareness? Where is the awareness? Are we talking about early screening? We can go on radio and talk about it, but do we have the facilities? Do we have the instruments? Okay? Let's talk about alcohol reduction. Let's talk about breast cancer risk. Let's have policies. Let's have healthcare reform in Dominica. Let's talk about having some sort of insurance coverage. All that money that has been wasted on so many things, we could have had a medical insurance program. Okay? Let's empower each other. Let's promote good, healthy living. And talk about breast cancer prevention strategies. All right? Let's not do things for optics. Because alcohol consumption is a modifiable risk factor for breast cancer. And we overlook it in our discussions when it comes to women's health. For Black women, the stakes are especially high. Combined challenge of high risk for breast cancer and the systemic disparities in healthcare. We're lacking things in our healthcare system. So I want you to take that message away today. Okay? Let's work towards a healthier community, a healthier country. I'm Dr. Dangleben on behalf of Patient Choice. Have a great day. Peace.